Good afternoon, and welcome back to HealthLeaders, the Winning Edge program, a series of webinars touching on the topics and strategies that you need to know the most. My name is G. Hatfield, and I'm the CNO editor for HealthLeaders and will serve as your moderator for today's session. Today's webinar is titled The Winning Edge for Nursing Leadership and Legislative Advocacy. Thank you to you and our audience for participating. Before we get started, for those of you participating in the live program, I have a few housekeeping details. Note that an on-demand version of this program will be available on our YouTube channel on Friday and can be accessed through our website, healthleadersmedia.com. To ensure that you can see all of the content for the event, please maximize your event window and be sure to adjust your computer volume settings and/or PC speakers for optimal sound quality. You'll find the main menu at the top of your screens containing all of your attendee tools. All tools are resizable and movable to personalize your webinar experience. To submit a question, please use the Ask a Question tool to submit any questions you may have during the live webinar or as you watch the on-demand recording. You may submit questions at any time during the presentation. However, please note that it is likely that your questions will not be answered until the Q&A portion of the program or via email at a later time. You can submit real-time feedback using the emojis at the bottom of your screens. And finally, if you experience any technical difficulties during today's webinar, please close out any other open browsers or applications and refresh your internet browser. You can click the Help in the top of the menu for more troubleshooting steps or reach out to us using the Ask the Question tool. At this time, it is my pleasure to introduce our featured panelists for today's discussion. First, we have Stuart Downs, who's the Senior Vice President and System Chief Nurse Executive at Northeast Georgia Health System. We have Jacqueline Herd, who is the Chief Nursing Officer at Little Company of Mary San Pedro. And last but certainly not least, we have Rudy Jackson, who is the Chief Nurse Executive at UW Health. Thank you all so much for joining us. And with that, let's get into our discussion. So first, welcome all of you. It's great to see all of you again. And I'd love it if you could tell me a little bit about yourselves and your organizations. If Jackie, you want to go first. I think we're having trouble.
Yeah, okay. I'm good. Can you hear me? So yes, hi, everyone. I'm so glad that you're here. My name is Jacqueline Herd, and I am the Chief Nursing Officer for Little Company of Mary San Pedro, that's located in San Pedro, California. Have been at this assignment probably for about a year, probably have over, I'll just keep it short, over 20 years. You know, once you get over 20 years, you don't keep going on in terms of how much your background is. And so I'm really excited to be here today and talk about advocacy is something that's close and dear to my heart, and looking forward with my other panelists to kind of share with you all.
Absolutely. And then Stuart, what about you?
Yes, good afternoon, everyone, and great to be with all of you today. I'm Stuart Downs. I am the Assistant Chief Nurse Executive for Northeast Georgia Health System, beautiful Gainesville, Georgia, which is in the northern quarter of the state of Georgia. I am celebrating my 3rd year anniversary with the health system actually tomorrow. I believe is the actual day of my 3rd year anniversary. So doing some incredible work up there with that health system. I'm also the president-elect of the American Organization for Nursing Leadership. So lots of things happening there from an advocacy and legislative standpoint as well. But great to be with all of you and share the stage today with Jacqueline and Rudy.
Absolutely. And then Rudy, what about you?
Thanks, G. My name is Rudy Jackson. I'm the Senior Vice President, Chief Nurse Executive at the University of Wisconsin Health System. We are based out of Madison, Wisconsin. Really happy to be here and to talk about such an important topic.
Absolutely. So just to kind of set the context for everybody watching today, as I'm sure all of you know, there's never been a better time than the present to begin advocating for nursing, as many new bills are coming down the pipeline. In July 2026 alone, a judge recently ordered that the Department of Education revise their list of professional degrees for loan eligibility. And in response, the DOE added nursing back to the list alongside several other medical professions for now. Also, the Senate Help Committee advanced a bill to reauthorize the Title VIII nursing workforce development programs, which will continue to fund nursing education and scholarships and loan repayment and all that good stuff. And that's only the tip of the iceberg for legislation that impacts nurses and patients and health systems. And for CNOs, it can be quite intimidating and overwhelming to know sort of where to begin. So I want to ask all of you first, why is it important for nurse leaders to have a voice in legislation? And Stuart, if you want to kick us off.
Sure. So great question to launch this discussion today, and I guess I would just say, first and foremost, advocacy, and specifically legislative advocacy, it's pretty much our responsibility as nurses. We should be able to speak about our profession and the legislative issues that affect it. As such, I also believe that we have an ethical responsibility and what I would basically call a professional mandate to basically lead the way and take up that advocacy mantle. The ANA Code of Ethics for Nursing, really, there's about 4 or 5 provisions in there that really speak to advocacy. Provision 3 is all about patient advocacy. I believe provision 5 or 6, I believe it's 6, is all about workforce and collective advocacy. 7 is specific around policy advocacy. So very, very important that we advocate on behalf of our profession. I give a lecture from time to time about executive presence. And one of the lines that I use in that lecture is that, executive presence for a nurse leader includes being the voice of nursing at every table where decisions are made. So not just the nursing leadership table or the finance table, but the strategy table, the quality table, the board table. It's the role of that nurse leader, I believe, to advocate for issues that are affecting the profession, patient safety resources, evidence-based practice, at the highest level of the organization, because I believe that if we don't do it, no one else will. And that advocacy for us to lead the way from an important standpoint has to be visible and consistent. It's not enough for people just to believe in it, but I believe the people that we lead and our colleagues have to actually see us doing it.
Absolutely. And Jackie, what are your thoughts?
And I agree, Stuart. And when you just said in terms of it's our story. So if I always believe that it's like if I want my story to be heard, then I need to tell it. And when we think about even just healthcare, we know healthcare is heavily regulated in legislation, laws, and policies. So as nurse leaders, we're the ones that know exactly what's going on within our doors. They can ensure that we are telling that story as to what's going on within healthcare at the bedside. We know policy impacts pretty much everything that we do, whether it's quality, safety, workplace violence, access to care. And as you stated earlier, just regarding legislation regarding education and Title VIII. So as nurse leaders, it's our role and responsibility, as you stated, Stuart, is to bring that story forward. Because if we don't share our story, then somebody else is going to tell our story. And they're not going to tell our story because we're the ones that are right there in the middle on the action line where everything is occurring. So it's bringing what's occurring at the bedside to reality, to our legislators, in order to share with them so that they clearly understand the decisions that they're making and how it impacts how we deliver care.
Absolutely. And then Rudy, what are your thoughts?
I would just make this a little bit more personal around our discipline and around our profession. One of my favorite quotes is how unfortunate it is today for men and women, benevolent men and women, to make decisions about things that they know nothing about. That quote was given to us in 1850 by Florence Nightingale, and we see it here time and time again, where politicians and policymakers across the aisles are, with the best of intentions, making decisions that are impacting nursing without leveraging the expertise of nurse leaders and operational leaders to be able to help navigate those decisions. I'll give you a perfect example. Wisconsin recently just had a new ruling that was signed by the governor where we can utilize baccalaureate prepared nurses to help teach clinical rotations for nursing students. Best of intention, wonderful. We've been doing it for decades, right? This is not novel. This is not new. We have dedicated education units where we leverage baccalaureate prepared nurses to help train and teach some of these students. And so, it was the best of intention. It was great, but is that really going to ultimately make the difference around what we're trying to do and the problems we're trying to solve? Or do we need to embed nursing leaders who actually are living and breathing the issues that we're navigating today to be part of the solution?
I think that's well stated, Rudy. When you were just making those comments, nurses comprise the largest segment of the healthcare workforce. And year after year, we all know we've been voted as the most trusted profession in America. Yet we are, I would say, chronically underrepresented in the rooms where, healthcare policy is written. So I'm a firm believer, G, that if nurse leaders don't translate what's happening at the bedside and what's needed for our profession into language that our legislators can act upon, someone else is going to do it for us. And likely, this may be a bold statement, but likely they'll get it wrong. We have to do it, to Rudy's point.
Right. That was a perfect example, Rudy, in terms of what you just provided. And so that's why when we talk about nurse leaders, why it's so important in terms of being able to share those stories, tell them what's happening at the bedside and what do we need in order to continue to further. So great example.
Absolutely. So to piggyback off of your example, what are some key pieces of legislation that all of you think nurse leaders should be paying attention to in 2026? If Jackie, you want to get us started?
So obviously, as Stuart stated, he is the president-elect for the ALNO board. I am a treasurer on the board and have been involved in nursing leaders in action through the ALNO advocacy. And not only the education in terms of the just recently changed, but things that we've always have been advocating for. When we talk about the nursing shortage, there are things that are happening around us that are further eroding that. So when we talk about workplace violence in terms of how do we ensure our nurses are safe, and whether I'm having a conversation with my nurse leaders at Providence, it's like, while different states do have legislation in terms of to protect our nurses in terms of for the SAVE Act, when we're looking at how do we across the country, because we know nurses travel from state to state if you're in a compact. So again, you may be in one state today and a different state tomorrow. And so, okay, what are the rules here? So when we're looking at legislation for the Safe Work Act, it's really focusing on federal in terms of what is the federal support? Because we know whenever the federal there are times I think it is appropriate for the federal government to get involved when it's related to healthcare. When we're looking across the country, we all are following the same rules regarding workplace violence. It means affording healthcare workers, not only just nurses, but healthcare workers, the same right that everybody knows when you get on the plane, you are going to be on your best behavior. Because the last thing you want is to say you will not be flying on this plane and the marshals are waiting for you because you just threatened someone or assaulted someone. So everyone knows that. So can't we have the same thing across the country to say if you offend or hurt a healthcare worker, this is what the repercussions are going to be. So it's not only focusing on workplace violence, obviously education is important to ensure that Title VIII, that we continue to have reauthorization, because again, Title VIII, whether it's education for our educators, whether it's providing access for in our rural areas for staff that are for underserved areas to ensure that they can take care of their community. And in addition to that, so there are things that we look at when you talk about we should keep our eye on things. It's not only those things that impact nursing and healthcare, but even from your perspective in terms of your organization, what are your organizational priorities when we talk about whether it's the 340B? I mean, 340B ensures that you have medication access at hospitals that provide care for the underserved, that they're able to purchase medications at a lower cost. Because think about it, if we have patients that can't afford their medications and they keep coming back to the hospital because they can't afford to get their insulin or because they can't afford to get their antibiotics, they're going to keep coming back. So having that 340B, and there's a lot of pressure to eliminate that. And so being aware and knowing what's going on, so not only from the nursing perspective, but also from your organizational perspective and what are their priorities. So I can continue to go on, but I'm pretty sure my colleagues have some other things to add to that as well.
Absolutely. Rudy, what are your thoughts?
Yeah, thanks, G. I'm going to, I couldn't agree more with Jackie. I'm going to add a couple of other areas. I think, and I'm going to tie this one to the other question you just asked. So for me, some of the things that I look at really closely relate to benchmarking and productivity, and how does that all, play out for us? There's a national push around mandated staffing ratios. I think if you asked any nursing leader in the country, they would say the same thing, that no two patients are the same. So having a rigid matrix to determine what a staffing number should look like is just not feasible. We need to take into account, this is very multifactorial, we need to take into account the complexity of the patient that we're managing. We need to take into account the comfort level, educational level, skill set of the individual nurses that are managing that patient. The workload of that patient is another big piece of this. So having a mandated ratio is not going to solve the issue. Furthermore, it's actually going to further complicate it because certain mandated ratios would limit hospitals from being able to function in rural states. In Wisconsin alone, we have 13% of our rural hospitals are at risk of closing. They don't have enough staff to be able to support the care that they have already are required of them. So that's a big one for me. I agree completely with Jackie around some of the things that are impacting nurses, like workplace violence and some of those issues. But I also think it's important that we pay close attention to other legislation that's happening that could have implications for our nurses. So an example of that is last year, there was a law that was going to be passed that was going to limit the amount of money that a caregiver could receive in the state of Wisconsin. It was like a child caregiver. The implications of that, while not directly related to nursing, has indirect implications to nursing, because if they make a change and we decrease the number of child care professionals that we have, then I don't have nurses that are going to be able to work because they have kids that they need to take care of and don't have a place to send them. So there is far more legislation besides the direct stuff that is impacting nursing that we need to be concentrating or looking at, within the state, but also nationally. Then we have a lot of things that are happening around advancing the practice of nursing, being able to oversee our own practice. I mean, like Jackie, I could go on and on and on. I think the point of all of this is we've got to be in touch with the changes that are happening. We've got to be connected with the Capitol and understand the implications of those changes, either directly or indirectly, to our teams. Stuart, what would you say?
Yeah, well stated, Rudy. I'll pull it back up again just a little bit higher. You gave a lot of specific examples there. We're just coming off of AONL Hill Day, or AONL Advocacy Day, as we call it. And there are so many different bills out there that, key legislation that really impacts nursing. And we talk a lot about, nurse faculty and clinical site shortages and things like that. But, one of those that is, if we're ever going to solve this, obviously we got to strengthen academic nursing. And, the future advancement of academic nursing, I believe it's Senate Bill 3435, HR Bill 6607. That's really to strengthen education pathways for our nurses by investing in nursing schools and students and faculty, things of that nature. And I'll just bring that locally, home, where, one of our academic partners was able to receive federal monies. I don't know if it was specifically from that or not, but it was all in the name of upgrading simulation labs at the nursing school. And they're partnering with us to say, well, how we want to come tour your SIM center and your SIM lab so that we can mimic it on the nursing education front. That's a direct example of why we want to support some of these national legislative issues that really impact us at the local level. Jackie touched earlier on Title VIII. That goes without saying, the workforce reauthorization, to really fund our existing workforce development programs. And then another one that's very near and dear to me and is really all about the Safe Healthcare Workers Act that also I think Jackie mentioned just a little bit ago, which is really going to provide that federal protection for healthcare workers, against violence, and not just violence, but intimidation of it, because it's so prevalent. It is so rampant in our hospitals and even in the ambulatory settings. So again, I could go on and on, with other key legislative priorities and advocacy priorities from a federal and state level. But I think our audience gets the gist of why this is important and what is important.
Yeah, can I just add one more thing, G? Because Stuart's absolutely right. I think when you start thinking about the numbers of nurses, I was talking to a group of nurses within our own organization, talking about leveraging technology to help make nurses more efficient. The reality is, my generation, the Generation X and the baby boomers, the generation before me, we make up 40% of the current workforce, and our retirement dates are coming fast and furious. The Generation X or Z and millennial generation, it does not have enough individuals to backfill the numbers that we're going to be shortage, or the numbers that we're going to be short. We've known this for years. So getting involved in this type of legislation that's going to help advance nursing education is incredibly critical.
Absolutely.
Well stated.
And so, yeah, absolutely. And all of you I know have done really spectacular work in advocacy. So I was hoping that each of you could share a time when you personally got involved in advocacy and made a positive change in your community. If Rudy, you want to start?
Yeah, sure. So in the state of New York, I had the opportunity to go to Albany and speak to some policy makers around a push to have mandated staffing ratios. And I was able to articulate, based on data that we had from states that had mandated ratios versus states that didn't, what the difference was. And we were able to move, rather than having a law that mandated a staffing ratio, move in the direction where we would actually bring nursing operational leaders together to look at what some of the crisis was what it was going to look like and how we could better solve that, solve the issue. And again, I think it's, as I mentioned earlier, it's very multifactorial. Here in Wisconsin, about a year and a half ago, I was given an opportunity to give testimony to our Senate about nurse workforce violence, and was able to get a bill passed so that it became a minimum year-long sentence if you assault a nurse, as well as some other fines. What I have found interesting, though, as a result of that bill, we haven't seen necessarily a decrease in the violence, but we're not seeing the number of people report it. I think that's something else that we need to think about as we think about advocacy for nursing. There are a lot of nurses in our field that just think that this is part of the job, that this is just how we deal with things.
Exactly.
And we're not doing a strong enough job making sure that nurses feel like they have that level of protection or that they have that level of support.
Absolutely. Stuart, what are your thoughts?
Yeah, I'll just give you a state level example, and then maybe an internal example. One was back in 22, worked with a group of nurses across the state of Georgia to really help raise awareness about the dangers of surgical smoke in our operating rooms and procedural areas, and the importance of safety on the caregivers, when using energy devices, in those healthcare settings. That resulted in the state of Georgia becoming a smoke-free state and in perioperative areas in 2022, when that bill was signed into law. So that's an example of, personally getting involved in advocacy at the state level. But here's my take on it, just a little bit different, is, I can advocate, and I am a staunch advocacy person, legislative advocacy person. I've been involved in this work for years now with AONL and love it, absolutely love it. But it's one thing for me as an army of one to be involved in advocacy, but if I can teach this and spread it across the health system of which I'm honored to lead, then I can get hundreds of other nurses doing that and advocating for the profession as well. I'll give you an example of that one. And I mentioned it earlier. It's about the Safety from Violence for Healthcare Employees Act, the SAVE Act of 2023. We went on a letter writing campaign with our local representatives around this, because we have, if I could share my screen right now, I could show you pictures, sadly, of nurses who have been the recipients of just awful acts of violence. And it's not okay. It is not the norm, and it should not be acceptable in our institutions. And so I was able to unite an army of people around a letter writing campaign to our local legislators about that. So that's one great thing. Another is, in our bringing advocacy internal into the organization through our professional nursing governance structures, really utilizing the AAC and Healthy Work Environment framework, to move top level leadership on system-wide issues. Because if I can get a nurse to think differently about how to advocate at the local level, that thinking will expand to the state level and even beyond at the federal level. So, reframing advocacy, if you will, as something that starts within our own walls. And I'm happy to say too, just most recently, we had a big professional nursing governance meeting, and they elected to have a system-wide council on advocacy, an NGHS council just for nursing advocacy. And so it's one thing for me to do it, but if I can get hundreds of other nurses energized around advocacy alongside me, think about how powerful that would be. And again, all under the auspice of, it's our federal mandate. It's our nursing mandate, if you will, from the ANA Code of Ethics. I know I keep referencing that, but it's so true.
Absolutely. And you're right. It's not just nurse leaders who can get involved with advocacy. It's nurses at all levels. So I think you're absolutely right. Yeah. And then Jackie, what are your thoughts?
Yeah. I was just thinking about, as I listened to Rudy and Stuart, and just, when you advocacy, it's whether it's at the local level, whether it's in your community, whether it's your state. I just recall earlier in my career, I'm originally from California, even though right now I do live in Georgia, even though I'm working in California. Just, in terms of just being involved, whether it's with your local police department or your EMS department. I remember being, in terms of my role in the emergency department at this time in my career, and being on an EMS in terms of committee council. And because at that time I worked at a small community hospital and we didn't have OB services, for example. So this is when you're talking about bringing the story as to what's happening at your hospital, bringing that to the legislators locally, because we would have EMS to show up and all of a sudden we're delivering a baby in the ED, or they show up in the ED and we're delivering a baby. And God forbid if they needed to have a C-section, now you're taking them over into the OR. And so I was able to make policy change to say, EMS, if the patient's in labor, then they should be able to get to the closest hospital that offers that service. And so we were able to change policy to ensure that EMS just weren't bringing the patients to the hospital to deliver the baby, but really taking them. And again, it varies from state to state in terms of access. Obviously, the hospital that I was at that time was in the city, and so therefore there were many hospitals around. So that's just an example in terms of just advocating at the EMS level. I think in terms of more recently, it hasn't been recent now, it's probably been about 3 or 4 years, just an example of the nursing compact. And so as a chief nursing officer at a large hospital in Atlanta, we worked with our policy advocates within the organization and basically went to the state capitol and met with our legislators to talk about getting Georgia as a compact state, because we had been trying and it had been defeated. And it was really being able to go and tell the story of why that was important, especially when you look at where Georgia is located at trauma center, get patients from Alabama, from North Carolina, from the surrounding cities. So really being able to have Georgia as a compact state would definitely help in terms of, because our nurses are already crossing over in terms of to practice, and being able to advocate for that. And, when you talk about understanding the whole legislative process, it's just sharing your story, ensuring your voice is heard. Now, how we were presenting for the compact to occur didn't quite happen the way we wanted it to happen, but when you get into politics, it starts off one way, but then it looks completely different. But at the end of the day, Georgia was able to be a compact state. So just being a part of that and at the last minute getting that across the finish line so that we were being able to provide that type of care. So.
Absolutely. And to kind of jump off your point about knowing where to go in government, what are some of the first steps that you think CNOs should take to really begin their advocacy work? If Jackie, I'll kick it right back to you.
Well, I can tell you in terms of being, and even though I've testified, in California for the staffing ratios, obviously my testimony didn't go very far because it was still voted in. But in terms of, I think it's so important, when you think about going back to school and studying civics, it's like, okay, let me just check the box and get this done. And I had to take it in college. But really, I think CNOs is really understanding the legislative process. Because I think understanding how that works, how a bill becomes a bill, whether it's the Senate, I think that's just kind of that overview in terms of understanding that. And so once you understand that process, it's like, how do you know who are your legislators, whether it's at the local level, who represents you at the local level, who represents you at the state level. And again, depending on what community you live in, you have different representatives. So I think it's understanding the legislative process of two different houses, and then knowing, how do I find out who is my representative? And I think that's important, because those conversations have to start inviting them to your organization, but, going to the website to find out, who is my legislator that I should be talking to, and whether or not it's a representative or the Senate. They have offices that are located locally within your community. So it's understanding, knowing who they are, and developing. It's all about relationships. You can't wait until you really need into a crisis that hit to say, hey, can you do this? When you've developed those relationships, and whether or not it's, I'm not at that age in terms of Twitter or the different accounts, but it's really following your legislators and connecting with them. So I think it's important to understand that in terms of how the process works. And then obviously, what are the priorities for your organization? Because your organization priorities, because when we're talking about healthcare, may be very different from what is your national professional priorities that you're advocating for as well. And so they're very different, whether it's federal, state, locally, professional practice. I think it's just really kind of starting there and understanding what that process is.
Absolutely. And I love your point about building those relationships before you need them, because it's kind of the same thing with like mental health, right? You build your safety net before you're in crisis, kind of thing. So I think that's a great analogy. Yeah, Stuart, what are your thoughts?
Yeah, Jackie has touched on a lot of, what my initial thoughts were. I think, the first steps for CNOs beginning their work in advocacy is start smaller than you think. I think people think like, I don't have time to do it, or how am I going to fit this into my schedule? But a lot of it is already there. So I would say the first thing you got to do is show up. Join AONL, ANA, other state, organizations or national organizations. They all have policy teams, that have probably already done the homework for you. So use their legislative agendas, to maybe create, action alerts and within your team, basically kind of as your own rep. Jackie touched on it about relationships. It's so important. I think you have to create that relationship with them so that they know who you are, so that when they need a trusted local expert, maybe when a healthcare bill lands on their desk or something, they know you are the resident person that they need to go to. And then I would tell you, one of the most powerful things I ever did as a nurse executive, as a CNO, and it was actually, fun fact, in the same hospital years later that Jackie was the CNO here in Atlanta, was I took a legislator on a walking tour through the hospital and right through that emergency department, that trauma center, around 7 p.m. I'll tell you, that right there does more than 10 position papers. Or it does more than, all the other things, because they're getting to see it, feel it, witness it firsthand. And then lastly, I would just say, more than often not, hospitals and health systems have their own government affairs office. Build relationships with those people. Get to know your local government folks within your own hospital, and let them know that you are a part of their team, maybe not, directly, but that you as a nurse leader, you want to know who they are and what they're advocating for within the state hospital associations, within professional organizations, maybe on the national level, but get to know your local government affairs folks at your hospital as well. Those are some of the small things I believe CNOs could do right out of the gate to feel comfortable about it.
Absolutely. And Rudy, what are your thoughts?
Yeah, going third is always the worst, because what else do you have?
Rudy,
I'll just add a
got
couple of
some
things.
good insight there.
I'll just add a couple of things. Jackie, you're absolutely right. I'm with you. I'm not much of a Twitter person. I don't know what was wrong with MySpace, right? Bring that back. That worked. It worked just fine. But I think, and Stuart's right. One of the comments I was going to make was around the specifically who can we connect with to build those relationships. I think government relations departments are absolutely critical. If your organization has one, get to know them. We're actually in the process right now of having our current government relations person retire, and we're bringing in a new one. When the new one arrives, I've already asked my executive assistant to schedule time with this individual almost immediately, because I want to make sure that I ensure that this person understands that any bill that comes across their desk that has any implications whatsoever to nursing, I need to know about it. And then I will decide what level of advocacy we need to have in that space. I also think it's really important that we connect with our individual hospital associations. Each one of them has an arm of nursing. Get to know that person, because that person is going to be very well connected with legislators as well. And then there was an interesting question that was proposed. What are some of the strategies to deal with some of the oppositions to your advocacy? And I think that one just deserves just a little bit of a moment for us to talk through. And that is, I've worked in a lot of hospitals around the country. As executives, we move around a lot. Being in the military, I've worked at hospitals all over the country, all over the world. And maybe it's the Midwest nice, but one of the grounding foundations, one of the tenets of our system here is that we seek to understand. When we can navigate those conversations when there's opposition and seek to understand what those challenges are, then we can find some collaboration. We can find some middle ground where we can work together to find the solution. I've worked in union environments, and I've said to an individual union leader, you and I are doing the exact same thing. We're protecting the people that we work for. There's no reason that there should be this animosity or this anger between us, because we're both trying to do the exact same thing. And if you can find that middle ground, you can make significant progress.
Mm-hmm. Well stated.
And the thing, Gene, when initially it can be intimidating and a little scary. And as Stuart said, in terms of where do you start? And, as I've shared in the past, being, I think that whole understanding the process and being able to speak in terms of what you're asking for, but, you share that story, but don't forget the ask. Okay, don't get so caught up in, sometimes we can get so caught up in telling the story that we don't say, are you going to support this? And, and I'm pretty sure Stuart talked about knowing your professional organizations, and all have probably umbrella or an area of advocacy within those different organizations, being a part of ALNL and being a part of Nurse Leaders in Action. And again, we're always looking for nurses to be a part of that across the country. And I think in terms of I can only speak for their training, because that's the one that I've attended, that there's training that makes sure that you're prepared and that you're ready and that you're comfortable going, whether it's going up on the Hill, whether it's going to your local. And so that is, if your organization doesn't offer that, there are either through your professional or even through ALNL in terms of Nurse Leaders in Action. And the goal is just to have a presence, to get our voice across the country in terms of when something's coming up, that we can jump on it really quick. When we talk about in terms of the loans regarding nursing professional practice, ALNL, we were right out there in terms of sending out letters to our local legislators in terms of what support we needed for them. So it's important just to kind of reach out and know that those resources are definitely out there and available, in terms of if they're unsure of what is the first step, what do I need to do, how do I get connected?
Yeah, Jackie, I think you're highlighting something really important. I think that is, as CNOs, CNEs, we play quarterback to some of these things, and it's really easy for us to get in front of these legislators and share data and share high-level implications from a national workforce perspective, and what does it look like for our discipline. But then we have to find those individual team players, those team members that we have that are actually on the front lines navigating this work, to share their story, and pulling them up and then getting them to a position where they're comfortable, and being able to support them is really, really critical as well. So I appreciate you saying that.
Absolutely. And we've talked a lot about advocacy at different levels, whether that be federal, state, or local. So how do those advocacy strategies really differ depending on the level that you're targeting? If Stuart, you want to get us started.
I actually thought you were going to go to Rudy since he said something about being third. So I was like, maybe I got a minute here to breathe. So, you got me right there. I was caught off guard. So I do think those strategies are very different. At the federal level, that's a long game, that's played through coalitions. And rarely does one single individual move a bill alone, at the federal level. So you have to combine your work with big professional organizations like AONL or like ANA, AHA, being present on Hill Days. That's how you make your voice heard there. I think the state level is where most of nursing's, what's the word I'm looking for, like operational reality, if you will, is actually decided, like our scopes of practice, our licensure compacts that Jackie mentioned earlier, workplace violence statutes, staffing legislations, all those things, that happens at the state level, and that tends to move a little faster, than the national or the federal level. For example, a Georgia General Assembly session is roughly 40 legislative days. So, my call to action there is that I have to have those relationships in the tank long before that session starts. They've got to know that I'm accessible to them, they're accessible to me. And then I believe the local level, in my opinion, is really about being present and problem solving, if you will. So, having relationships and conversations with your county commissioners, maybe, or your boards of health, your school boards, workforce development councils, if those exist in your local areas. That's where, in my opinion, things like, EMS coordination and community health investments and pipeline programs with local schools, that all happens at the local level. So that's kind of how I would distinguish maybe the three of those. It takes a long time at the federal level, and you can't do it alone. States are much faster and relationships are key there. And then local is, all about what I would just say, maybe presence and partnership.
Mm-hmm. Absolutely. Rudy, what are your thoughts?
Yeah, I'm going to be a little controversial here since we've got some members of the AONL, soon-to-be president and advocacy group. I think at the federal level, so I couldn't agree more about the state and local level. I've been in Wisconsin, it'll be 6 years in a couple of weeks, and we have probably one of the most unique organizations I've ever worked in. Our board is 100% politically appointed. 100% politically appointed board. So depending on what party is in government is going to dictate the future of our organization. Now, our CEO does a phenomenal job managing the board. They're all fiduciaries for what we do. And so politics don't necessarily always play a role in decisions that are being made, but that's an interesting uniqueness of our organization. And I couldn't agree more that the state and local level organizations are the place where you can really start to influence change for your individual group. I think where it becomes a little bit more challenging for me, and I would argue even a little bit frustrating, and I say this respectfully, I've been a member of AONL for decades. I've been a member of ANA for decades. AONL and ANA don't always agree on the same issues across the aisle. And so when we have the two largest advocacy groups for nursing on opposite sides, it makes us, we come across fractured. And it's difficult for me to navigate things at the federal level when I know that, number one, it's going to take forever to get done. But number two, we can't even agree as a discipline the direction that we need to go. And I've oftentimes been struck by the idea that, if we could just find some common ground as a profession, as a group, as an individual, discipline, we would be unstoppable. And yet we can't seem to find those common grounds in a lot of these areas. In terms of how I get involved at the federal level, quite honestly, I continue with my dues. I continue to listen as to what's going on. I use the information that I see at the federal level to help influence the things that are happening at the state level that I feel are going to help benefit nursing in my local area. But I do think that there needs to be more of a push at the federal level, getting more support out there for us.
If I could just comment, Rudy, in terms of just regarding the comment regarding, and again, I think it's not like it's a big secret, but it's interesting because probably about 8 years ago, and he was, I think, president for GNA, but he was a lobbyist for the AMA, for the American Medical Association. And what he shared was to say, this is what he shared with me. He says, the problem with nursing is that, and again, it's not just AONL, ANA, the problem with nursing in general is that you guys don't know how to come together as one. When you look at the AMA physicians, it doesn't matter if it's a podiatrist, an orthopedist, a cardiologist, they all come together as one. And so then therefore they have a much stronger body. And I had to step back and like, okay, wow. And so, yes, we've got work to do, you know, as it relates to that, but you're definitely spot on regarding that. You know, I think in terms of, I think we've all have talked about in terms of the federal level, the local level, and the state level. I think if I was to sum it up, it would be the issues are somewhat the same, but the decision makers and the ask is what's different.
Mm-hmm.
Yeah, and well stated, Jackie. And I would just throw back up there, you know, that again, not to be controversial, but I do believe that we agree on more of the issues where we're alike than where we're different. I would just throw out there for everyone to, I'll throw out this website, thenursingcommunity.org. That's the Nursing Community Coalition, which is a coalition of nearly 65 national nursing organizations who advocate together, who advocate similarly on different, you know, nursing issues impacting our profession across the country. Would encourage folks to go out and look at that, thenursingcommunity.org, and check it out.
Yeah, I appreciate that. And I'm familiar with the group. You know, Jackie, you brought up the AMA. You know, the AMA is right now trying to push advocacy to create CPT reimbursement codes for artificial intelligence when artificial intelligence is used for decision making within nursing or within medicine. At what point do we start having conversations about nursing becoming a reimbursable service? At what point do we start to challenge the paradigm of us creating a secondary reimbursement model when we haven't addressed the challenges that we have with nursing not being a reimbursable model?
And
all
again,
the more reason we need nurses involved in advocacy for those very reasons right there, Rudy.
And for us to all be on the same page with that, you're absolutely right. And that whole issue in terms of the AMA and using artificial intelligence is already out there. And again, is creating problems for our physicians in their offices in terms of how they are approving to pay a bill or not to pay a bill. So yes, you're absolutely right, Rudy, regarding that.
Absolutely. Well, this has been a fantastic discussion so far, and I want to make sure our audience has some time to ask some questions. So this is going to bring us to the Q&A portion of our program, and we would now like to invite you in the audience to ask questions of our panelists. As a reminder, if you are participating in the live program, to submit a question, please use the Ask a Question tool. Please note that your questions will remain anonymous and will not be viewed by other audience members. We'd also love to hear your feedback on today's webinar, so if you'd like to take a moment to complete the brief survey located at the top of your screens, we would greatly appreciate your input. So first, we have a question here. How can nurse leaders balance their operational responsibilities while also making time for advocacy efforts? If Rudy, you want to go first?
Yeah, that's a great question. You know, I tell the team, you know, again, one of the unique differences of UW Health versus other organizations is we have a triad model. So all of the CNOs of our hospitals report directly to me. So I have direct operational oversight of nursing, and the CNOs of those individual hospitals are a triad partner to the hospital president, the hospital chief medical officer. So no decision is made on behalf of nursing without nursing making that decision. We're only as successful as the team around us, right? I mean, we all know that. And so if you've got the right leaders in place supporting your initiatives and supporting your your philosophies, then you actually can carve the time out you need to be able to start to spend time with those legislators and to start to understand what are some of those things that are coming forward, and then start picking the right people to help be the voice to drive the legislation that we want to drive forward. You know, when I had the opportunity to present to our local Senate here on workplace violence, again, I could share all of the data. I could share all of the information around what we're doing, but bringing in a direct care nurse that's actually been in that situation
Bingo.
and hearing their story, that was incredibly powerful. That was it wasn't my testimony that changed the lawmakers. It was that individual's testimony being able to be shared with them. And so finding the time and being able to allocate that is incredibly important. I would argue, with all of the challenges that we're facing in healthcare as nursing leaders, nothing is more important today than our advocacy in this space.
Absolutely. Jackie, what are your thoughts?
No, Rudy, you were spot on. And again, you know, we think about advocacy, it starts even when just in our own jobs within the side of our walls of our organizations, where you're advocating for a policy to be changed. And so it is critical. It's something, it's not when I have time or if I have time, it's about really, this needs to be a priority. I was at a conference, I was just thinking about I think it was San Diego. And when we talk about workplace violence or nurses getting assaulted, and then the district attorneys, and again, this is in a different state, choosing not to process the individual. Well, it was the hospital's administration that decided to develop relationships with the police department, and also in terms of the district attorney to say, this is what's happening in our hospital. Let me share a story. So again, that was critical for them to create this infrastructure now that they have, where their employees come to work and they feel safer, because people, again, they are being penalized and in terms of when they assault a nurse. So that's why it is so critical, important in terms of starting small. Doesn't need to be big, just starting something very, very small. I think Stuart spoke to that earlier, but it's not a, do we have time? It's something that we have to do.
Mm-hmm. And Stuart, what are your thoughts?
Well, not much to add to that. You know, I think to Rudy's point, you know, I too have all the CNOs from my campuses report directly to me in much the same model that he just referenced. And so I think when we, as executive nurse leaders, set the expectation, you know, that we want you to be involved in advocacy efforts, you know, then it becomes part of their daily standard work. But I will also tell you this, I think there's a misnomer out there that, you know, back to the question, I believe, which was something around, you know, how do you balance operational responsibilities with making time? It doesn't take a lot of time. You know, I believe you can start small with just an email to a representative or a local congressional leader, or send a letter in snail mail, or, you know, something of that nature. It doesn't have to be some big grandiose thing where you got to spend 2 or 3 days on the Hill and all that. We can start small. We can make time for advocacy efforts, you know, if we really and truly put our minds to it.
And sure, can I add something?
Go ahead, Jackie.
Just a comment regarding what you said, and it goes back to starting small. It's just inviting them to your hospital to take a tour, because what we've heard is that we don't hear from the frontline nurses. And so therefore, it's just inviting them out. Take a tour of my hospital, come visit my emergency department. So it's just like you said, it's just starting small, but making that connection.
Absolutely.
The other thing I was going to add was that sometimes as advocates, the policy that we're moving or trying to advance may not be consistent with the strategy of the organization. And how does a leader manage that? How do you navigate that, right? I oftentimes tell folks that I will still advocate for something if it's inconsistent with our strategy. I may just do it independent of the organization and do it as a nurse leader. So, you know, and I will talk to our CEO, I'll talk to my boss, I'll explain what I'm doing, why I'm doing it, why it's important. But at the end of the day, this is about us as leaders, us as nurses, advancing our positions for the betterment of nursing. Right? That's what this is about. And so even if it doesn't align, we can still be out there supporting the policy.
Absolutely.
Exactly.
Spot on, Rudy. And that's why it's so important that we really have those strong relationships with our government affairs office, because that way we'll know if we're in alignment with our local institution or not.
That's perfect, Rudy. You're absolutely spot on because we all vote. And so whether that's in our community in terms of, and they represent us. So we are their constituents. So absolutely.
Absolutely. And then another question here. You shared that nurses or nursing often struggles to come together as one voice. So what is the single issue that could realistically unite the profession right now? And what do you think it would take to turn that alignment into action? The hardest question of the day, I think.
Oh, gosh.
If Stuart, you want to start.
I volunteer to go last.
There you go, Rudy. There you go. You know, here's the short answer for me. I don't know if there is a singular issue. I'm not real sure. There's a lot of things right now, you know, that are impacting our profession that we need all nurses advocating on and with collectively to really show strong alignment so that we can turn it into action. Again, you know, one of those is all about workplace violence and the SAVE Act. There's another around, you know, we want to have strong pipelines, then we have to advocate, you know, for all the various bills and legislative activity out there that really is going to drive, you know, impact to that end. So I don't know that there's a single issue that will unite the profession, but if I had to choose one, you know, no one wants to get spat upon or kicked or beat, and it's real. It is real all across this country. Another one too, I think that we could all, you know, probably advocate on is rural health, you know, and all the things, you know, impacting rural healthcare across our country today. You know, if all of rural health went out, all of inner city hospitals, you know, couldn't accommodate the volumes, and it would just be, you know, further, you know, a hindrance to you know, strong healthcare across the country. So I think it's important for all of us to even advocate for things in rural health. Again, I feel like I'm rambling right now, but I don't know that there's a singular thing out there. But I do know this, to Rudy's point earlier, when we all come together on whatever that singular thing is, and we do ANA, AONL, AORN, whoever it is, when we do speak with one voice, magic happens.
And I agree, Stuart, with what you said, but, you know, I was going to, if I was selected to go first, I would have said workplace violence as well, because it's not only just a nursing problem, it's a healthcare. So you're talking about physicians, you're talking about teachers, you're talking about educators, you're talking about the CNA. It's a massive, so again, it's not just nurses that are being harmed. Physicians are being harmed, healthcare. So again, it's healthcare workers in terms of how do we ensure that, you know, they feel safe when they're going to work, and not have to worry about violence or being assaulted or being spit on. And again, whether it's even, I was thinking about that even in academia. Now you've got, you know, people that are showing up, shooting up at the schools. So I think that's the one I would say. If there's a close one, then yeah, I would agree. Okay, Rudy.
Yeah. You know, I'm going to.
What's that one issue, Rudy?
G's probably never going to invite me again, but I'm going to get controversial. I subscribe to the philosophy that the patient comes second. I don't put the patient at the center of any decision I make. I put the nurse at the center of every decision I make, because if we put the nurse at the center, the nurse will put the patient at their center. If I had one thing that I could wave a magic wand, I think if you were to ask every CNO around the country, we'd all come up with a list, and in that list would be workplace violence. There would be, you know, ratios. There would be all of technology. All of these different things would pop up. But if there was one thing that I could do, and this may get a little bit Pollyanna, it would be that nurses' influence in decision making has been elevated equal to other decision makers nationally. That as nurses' voice gets raised, as nursing concerns get brought forward, that we can influence change on the countless and numerous initiatives that we have in front of us today. So I know that's a little Pollyanna. It's not one specific issue, but for me, it's really that foundation. It's every issue. It's raising the credibility and the respect amongst our profession so that we're all able to advance these initiatives forward.
Absolutely. And I think
that was well stated, Rudy.
I think we have time for one more as we come up on time here. So quickly, how can nurses overcome the perception that legislative advocacy is only for executives or professional organizations? If Jackie, you want to kick us off for the last one.
So, and I think Rudy spoke to that. As nurse leaders, we have a role and responsibility to play it forward. And really, again, when I hear a statement say, oh, I'm just a nurse. No, you're not just a nurse. You are a nurse. And nurses, believe it or not, they start advocating at the bedside. So you already are advocating. You're advocating when you feel like something's not right with your patient. That's where advocation, that's where you start advocating at. And again, whether it's your professional practice councils, nursing shared governance councils, it's starting small. It may be for policy change. It may be saying, okay, well, for your CNOs, or whether or not, I truly believe that every nurse should belong to their professional organization. And belonging to the professional organization and really getting involved in terms of what are they advocating for? What is that advocacy for? Professional organizations are not just for nurse leaders, they're for nurses. That was in terms of ALNL, in terms of, I believe every single nurse is a leader because you're leading your patient and your care team at the bedside. So for me, I believe that every single nurse is a leader and you have a voice. And if we don't hear your voice and you're the ones that's closest, I think Rudy stated, you're the one that's closest to the patient. You're the one that can really help us to know what that story is. So it is absolutely even more critical for frontline caregivers to be involved in advocacy as well. Sorry, I must have taken up the last 2 minutes.
No,
Sorry.
that's well stated, Jackie. And I'll put the cherry on top right there. The code of ethics doesn't just apply to healthcare executives. It applies to every nurse. And so I just pulled it up. Provision 3, I referenced it earlier, directly states that the nurse promotes, advocates for, and protects the rights, health, and safety of the patient. And that covers all areas, from entry to exit, with patient care. So that's why it's not just applicable to healthcare executives, it's applicable to every nurse. And Rudy's well stated that previously.
Absolutely.
Great question.
Well, I think that is a beautiful note to end on. Unfortunately, that's all the time we have for today. Before we conclude, we encourage you to share your feedback by completing a brief survey, which will appear at the close of this session. Your feedback is greatly appreciated and will help us improve future events and provide more valuable content for all of you in our audience. And remember to follow along all week for continued coverage on nursing leadership and legislative advocacy by visiting our website, healthleadersmedia.com. As a reminder, the webinar recording will be emailed to you once it becomes available, and an on-demand version of this program will be available on our YouTube channel on Friday and can be accessed through our website, healthleadersmedia.com. And finally, I want to thank our panelists once again so much for this excellent discussion, and thank you to everyone in our audience for participating. We hope you enjoyed today's program, and we look forward to seeing you during our next Winning Edge program. Thank you, everybody.
Thank you.
Thank you.